If you've ever opened a lab result at midnight and immediately Googled one scary number, this story is for you. The promise is simple: less panic, better questions, and fewer lonely rabbit holes before you talk to a clinician. Hims and Hers has launched an AI agent for lab results, according to a same-day Tech Target report in today's news pool. And the headline sounds like another health tech feature. But the everyday change is much more specific. It is not really about replacing the doctor. It is about replacing the worst 5 minutes after the test result arrives. You know the moment. The portal notification lands, you tap it. Suddenly you're staring at abbreviations, ranges, flags, and numbers that feel important but don't explain themselves. One value is a little high, another is a little low. Then the search spiral begins. By the third tab, you have diagnosed yourself with something terrible, something rare, and somehow also dehydration. That is the habit AI is trying to interrupt. The useful mechanism here is translation, not diagnosis. Translation. A good lab result agent can take the raw medical language and turn it into three calmer layers: what this number usually measures, why it might be outside the reference range, and what question you should ask a real clinician next. That last part matters. The dangerous version of this future is an AI that sounds confident and tells you what is wrong with you. The useful version is more modest. It says, here is what this could mean, here is what it does not prove, here is what context matters, and here is the follow-up question worth bringing to your provider that changes the patient's role. Instead of walking into the appointment embarrassed, confused, or armed with 10 random screenshots from search results, you arrive with a cleaner question. Not, am I dying? More like, this marker was above range, I had these symptoms, I take this medication, should we repeat the test or look at another factor? That sounds small. It is not. Healthcare has a strange information gap. Patients now get data faster than ever, but understanding still arrives later. Portals gave people access. They did not always give people peace. So the next daily habit may be: test result arrives. AI explains the map. Human clinician helps decide the route. And yes, there is a trust line here. Lab data is sensitive. Medical advice is regulated for a reason. A lab result agent has to be careful about privacy, disclaimers, escalation, and not turning every mildly weird number into a confident conclusion. But if it is designed well, the product does not need to be dramatic to be useful. It just needs to remove the panic tax. The bigger signal is that AI's most believable consumer role may not be the all-knowing doctor in your pocket. It may be the calm translator sitting between scary data and your next human conversation. That is the everyday future I would watch for, not AI replacing care. AI making you less lost before care. And the people who win are the ones who use these tools to become better patients. Calmer, more prepared, and harder to scare with one unexplained number on a screen.